Good evening and welcome back to blackdoctor.org. I am your host, Dr. Renee, and tonight we have a special show about breast cancer awareness. It's part 2 of Living with Breast Cancer. So tonight we have some amazing guests. We've got 3 physicians and a survivor. So I am very excited for you to meet our guests this evening. We have Dr. Cynthia Jones. She is a breast and minimally invasive surgeon. And Suzette Simon is our survivor and thriver of breast cancer. Dr. Naomi Dempsey is a breast medical oncologist. And Dr. Sandy Kotaya is a medical oncology and hematology at Mercy. Okay. So thank you, ladies, for joining us this evening.
It's a pleasure.
Yeah, it's a pleasure.
Thanks for having us.
Oh, of course. So let's get right into it. This is going to be a great conversation, I know, because one, we do have a patient, and then we have experts, so we can get lots of information to our guests. Everyone, please, if you have any questions, type them in the chat. I will try and see if we can answer some of those questions if we have time. Also, if you could let us know where you are watching us from, put the city and the state. And lastly, sharing is caring. So do not forget to share the broadcast. No matter what platform you're watching on, please share the broadcast because inevitably, especially the way breast cancer is these days, you know someone or someone you know knows someone that either is about to be diagnosed or already has been diagnosed with breast cancer. So let's get into it. So I'll just pose this to all the doctors. What are some common challenges that breast cancer patients face during treatment? Anyone can take it.
All right. Well, I can start there a little bit. I think the initial challenge just comes with the shock of the diagnosis. Nobody ever expects at any age that breast cancer is going to be part of their lives. I think everybody goes for their mammogram and they're kind of just expecting normal results, and then you hear an abnormal and it just feels like your whole life is kind of getting derailed. And a lot of these women, they're wives, they're mothers, they have careers. And so often I hear from patients like, this just wasn't part of my plan. This wasn't the way that my life was supposed to go. But, 1 out of every 8 women in the United States will develop breast cancer at some point in their life, and it's extremely common. So I think kind of coming to some acceptance of that diagnosis and being ready to get on the journey of treatment can be a big initial challenge, and then figuring out how to balance maybe a life that was already full of all those other things that you're doing. And then on top of it now, perhaps part of your treatment plan is chemotherapy, and you're going, once a week or once every 2 weeks for treatments. You're dealing with side effects. You're still trying to get dinner on the table for your kids. So there's a lot of challenges, but that's why it's so important to have a whole team, not only a medical team, but your own personal support, the partners in your life that can come in and help you during a time that's difficult.
So, go ahead.
And so we take it at each phase. I mean, I am involved in the diagnosis, and then the if we call it early enough, the early stage treatment of it. So for me, it's demystifying the process for the patients, helping them understand, okay, you have a lump or you have an abnormal finding on your studies. What's next? Taking them from that to the biopsy to what the possible treatment plans are, and letting them know, as Dr. Dempsey said, that there's a team behind you, that we're here to support you, that we can, obviously your treatment plan will be tailored to what your particular diagnosis is, but that we will be able to take care of you and support you on your journey and get you back to as soon as possible back to your regular life.
That is wonderful. And then I know here in Chicago, well, yeah, it's here in Chicago, but I think it might be national too. The Thank God It's Natural Foundation, TGIN, they have they've done over a lot of the waiting rooms for breast cancer patients. They've also set up where they give money so that different challenges like getting to the hospital, getting, from the hospital, parking while you're at the hospital, so that all those things are not barriers for people. They give money for that. Christia Donaldson was a dear friend of mine. We met when I was in the 11th grade, and unfortunately we did lose her to breast cancer, but she started this foundation shortly thereafter her first diagnosis, and they're still going strong, which I'm so happy about. And Dr. Dempsey, when you mentioned the diagnosis or abnormal mammogram, I had an abnormal mammogram that scared me out of my good mind. And I was like, oh my God. And they didn't tell me. That's what made me so mad. So I got a call less than 24 hours after my mammogram, which of course alarmed me. So they had left me a message, and then I called back, and it took like all day and no one called me back. So I called again. Finally, I get someone on the phone, and the person had an accent. It was very distinct. So I knew it was the same person. I said, you left me a message. I just need to know what's going on. I am a doctor. You can just tell me. So she said to me, my mammogram was incomplete. So I make the appointment and I go back, and that's all I'm thinking. It's incomplete. I happened to be hanging out with 2 OBGYNs at the time when I got this information, and they said, oh, that's common in your age. You're fine. Okay, great. So I show up, and I'm getting the mammogram, and the tech was like digging, and I'm like, what is this woman doing? This is not like the first time. I didn't say anything though. So then she says, I have to get way back here because, they found it back here. You could have knocked me over with a feather. She looked at me and said, they didn't tell you, did they? I said, no, they didn't. And so then she said, oh, they found something on the back wall here. And so that's why we have to get specifically this breast and all the way back here. And when I tell you, I swore I was white as a ghost, because I was just like, what did this lady just say? So she said, well, the good news is that you will not leave here without results. And I said, okay, thank you. And so I went back and sat and waited. And the nurse that came and got me, she just looked all bubbly and cheery. I said, oh, praise the Lord, this is over. She's like, oh, come on back. I come back. She goes, okay, they found something. I just was like, take me now. I can't take this. This is too much. And she's like, so the good news is we have a biopsy available tomorrow afternoon. I said, I'll take it. And so I had my biopsy the very next day, and I think I had to wait like 3 more days for the results. It was about to be Memorial Day weekend, and needless to say, my mother was ringing my phone every hour in the hour. Did they call? No, they did not call. And so I go, Mom, I'm not going to let them leave for the holiday without telling me something. And because the doctor had said that I would know before the holiday too. So sure enough, they said it was nothing. It was a calcification, and they put some little metal clip on it. So he was like, you'll know, and they'll know from now on. And I said, okay, thank you. And that was just, and I mean, thank you, Jesus. I didn't get the diagnosis, but I know those beginning steps and the challenges of those steps. Yeah. So Suzette, can you share with us how you learned about your breast cancer?
Totally. So I am the daughter of someone who died of breast cancer. So I was really diligent about getting mammograms and, trying to make sure that I took care of my health. And then, and then I got a mammogram, and then it turns out I always had dense breasts. So I always, I went back, but then I was diagnosed in 2020. And the thing is, I think when you talk about challenges, the most important challenge is that I think it was really important for me to find the right team, because my mom died 30 years ago. And at that time, when she had her diagnosis, I mean, she had an operation and she was left flat. So basically, she walked around the house. She had like one really long boob that kind of touched her knees. So it was basically like a perpetual game of hacky sack with watching my mom. I had no idea like what her self-esteem was like. So I sort of watched that. And then also too, on one of her final days, she didn't have insurance, so she was lying on a gurney in a public hospital hallway, waiting for hours for a room to become available. And when I walked away for a minute, someone had stolen her wig, and at that point, it wasn't even a wig; it was more like a Chewbacca toupee. So I was like, "Damn, people are desperate for weaves in Brooklyn." So that's the thing, is like, the challenge for me has always been about making sure, because I had the luxury of insurance. So I was always making sure that I had the right team. So that meant that I, of course, got a second breast exam, and then I got a third, and I got a fourth, and because I'm single and lonely, I got a fifth. And so by the time I was done, it was like, I was like I had like half of New York owed me dinner. And yeah, more like I was like a college co-ed in Cancun. It was like, so yeah. So the challenges have always been like just making sure that you have the right team. And so I tell everybody, like, when you find out you have cancer, cry it out. But like, you just know you have to get your girl squad together. And even if you don't have a girl squad, your phone is your girl squad. You make sure you take your phone in with you. And if you don't feel comfortable with a doctor, you go ahead and you find someone else, because I went through 5 breast surgeons, 6 plastic surgeons, 5 hospitals. And I wasn't being picky. It was all little different things that just sort of worked or didn't work, because, the breast surgeon works a lot with the plastic surgeon. And I just want to make sure that I kind of mesh with both of them. So sometimes I would like the breast surgeon, but I didn't really sort of feel comfortable with the plastic surgeon. And so there were a lot of different factors in the hospital sometimes too. Like, I even looked at a public hospital because I really liked the surgeon there. But so, so there were a lot of different factors, but it's just like the major challenge is that you feel comfortable that you have the right team for you.
Yeah, I agree.
Can I guess interject a little bit to
Yeah.
say that, just like Dr. Dempsey was saying, and Suzette and Dr. Jones, like you have to have a team, and the team has to include people outside of the medical team that take care of, like, here's your chemo, here's your surgery, but the nutritionist, because I get so many questions about what am I supposed to eat now, and how am I supposed to eat now, how am I supposed to eat through chemo, what am I supposed to avoid eating, and then the other question is, can I have some help with FMLA? Can I have some help with figuring out how to pay my bills? Because, again, like Dr. Dempsey said, people have lives and bills, and if they don't pay their bills, they might be out of a house, or they might not be able to get to treatment. We have a patient navigator who can help hook people up to transportation. In the ideal world, we would have an integrative medicine center. So if people want to do integrative medicine on top of what we offer, we haven't gotten there yet. Mental health therapists are super important. We don't have enough of those to get people through the stress of dealing with a life-changing diagnosis. And the other thing is, sexual dysfunction is so rampant in women who go through breast cancer and gynecologic cancers. It's like 80% of them will get sexual dysfunction. They don't feel attractive anymore. They don't have the desire to have sex. They become disconnected from their partners. All these things that rocks their world on multiple levels. So it has to be a global approach to the person. And of course, one of the things that helps you survive cancer and helps you get through cancer treatment is exercise. And if you've not been active before, now we're pushing you to stay active to get through treatment better and to try to, have better long-term survival. So motivating people and getting them to cancer rehab or getting them to do exercise programs, it's a lot. So, people get overwhelmed just hearing they have cancer, much less all the things they have to do to get through the cancer treatment.
Yeah.
I totally agree. I think that your best friend in the entire process is not your oncologist, it's your patient navigator. Because I went to 2 hospitals. I had surgery at one, and then I had my oncology and radiation in another. And so one hospital actually gave me an email with a list of resources, and then the other hospital gave me transportation. They gave me an email with a list of resources, but they gave me transportation. They gave me $2,700 in cash. No questions asked. Uncle Sam, close your ears. No questions asked. I ran out of that hospital with a wad of cash, screaming, woohoo! So your patient navigator is definitely your best friend. And also when you're dealing with cancer and you're also dealing with other organizations that are helping you too, the patient navigators are great there too. It's always good to know, to be able to talk to them as well. And then what's good is if any information that you get from one navigator, you should always pass on to the other. I think that that's good karma too. There were some things that I learned from one person that I passed on to the other. So it's, it sort of becomes like a full circle.
Definitely. Can you share what it's like to live day to day, on a day-to-day basis with breast cancer, physically, emotionally, all of that, Suzette?
Oh my God. Living with breast cancer is day to day is a lot of work, because you're doing all this stuff to stay alive just to get 50 emails from the Democrats. It's you got to save yourself and you got to save democracy. Oh my God. it's, I mean, there's a lot of things. There's fatigue, but then I told you you could get transportation. If you don't know that, I have learned that on average, the number of steps on in any subway is about 17 steps, because I had to, like, that was sort of my challenge. Like, I was so fatigued, like, if I could get up the steps, and that was like my big, like, my big champion thing each day. So yeah, so it's fatigue. It's the pain from chemo, knowing that you can get bone pain from chemo and that you should take Claritin, the changes in stomach and your stool, constipation, lymphedema. Before I had breast cancer, lymphedema was the aunt who made my favorite mac and cheese restaurant. Auntie Dima, Auntie Dima. I mean, it was just, so, and then I got so high from steroids and so hyper. I think if everybody knew how hyper you got from steroids, that the entire, like, more people would want cancer. It was just crazy. I was just so hyped up. Mobility issues, even now, like, I still have, I walk with a limp, which is great because I'm single. So guys, you can catch me now. I'm not moving that fast. I'm not moving that fast. And then of course there are burns from radiation. So, basically, I had 25 sessions, and on the 23rd session, my boobs turned into like Kentucky Fried Boobies, like rotisserie titties, like extra crispy, really extra crispy. So, I call them rotisserie titties.
Oh goodness.
And
Wow.
so yeah, so then, at that point, so radiation, with the burns and stuff like that. So there was sort of the KFC extra crispy. Right now, their regular recipe, I have to say. But and then there's the hair loss. I thought I could trick chemo by like putting my hair in braids and like maybe going sort of Rasta with it. But then I woke up one day and it just kind of slid. The entire thing just sort of slid off like a lace, like a loose lace front. It just like
Oh wow.
back right off. And then of course right now I'm dealing with male pattern baldness. I can look at like the dollar bill and say, hey, that's my selfie. Yeah, because it's all retreat in the front and revolution in the back. And there's a lot of anxiety there. Yeah, but I think that the worst part of cancer that I'm finding right now is just irrelevance, because I've been leading this fight to like raise awareness and taking on the challenge, and it just seems like like Black women are just always having to like prove our humanity, our dignity, our worth, and this thing too. It's like always trying to get people to understand that like that this is a crisis. Like these numbers are not great, and just sort of finding that like this sort of like thing that is just not being prioritized or recognized in the world, that like that this thing can be with a little bit more awareness, that we can actually take the numbers down of the mortality rates and the disparities and the death rates for women of color. So that's, I think right now the biggest challenge is just the fight, but the fight for awareness. But those were sort of the day-to-day things, and the financial decisions too, like you're living to stay alive just so that you can pay rent. Like, like, oh my goodness. So just so many things. But one of the things that was helpful was getting into groups. I highly recommend people find some sort of support group. And it doesn't have to, and you don't have to think that like the one group that I did the same thing like I did with my team. Like I wasn't satisfied or happy with the first group that I got. And then there was another group, but then I found a group of people through Gilda's Club who had, like senses of humor and about cancer. And so that was sort of the group that I fit in. And yeah, and it's great because there were also men in there too, because the thing is, I think the worst part about doing chemo is that they never put the breast cancer chemo suites next to the prostate cancer chemo suites. Because the thing is, like, everyone is dying to be your first, everyone's dying to be your last. So you gotta find men wherever you can. So I recommend that any hospital out there to like make sure that the prostate cancer suite is on the same level as the breast cancer suite. Like do a girl a favor. Do a girl a favor.
Suzette, I was wondering, since your mom had breast cancer, did you get tested for the gene?
Yeah, I did, and there was no
Oh.
yeah, there was no. But the thing is, like, one doctor told me that I was actually lucky because I had an old white lady's cancer, and I was like, "What? Are you telling me that like what? Like are you telling me my boobs are Karens? Like, are my boobs gonna call the cops on me?" So it's like we didn't. It wasn't. There wasn't a genetic connection. But then again, they haven't tested all the genes anyway,
Right.
so you never know. So there could be down the road. So I'm just waiting, but there wasn't a connection.
And any of the doctors, how do you approach that subject with your patients that have, maybe they have daughters or even sons, shoot, they have family members and they have breast cancer, or maybe they already had someone with breast cancer?
By the way, before we answer that question, Dr. Jones, I'm gonna just pop Suzette's bubble for a second and just remind you that the other group of people who have sexual dysfunction are men with prostate cancer. Just so you know. By the way, hi, Suzette. One of my patients said hi to me. Sorry, go ahead, Dr. Jones.
I was going to say, one of the first things that people say is, well, no one else in my family has breast cancer. How do I have this? And so that's one of the first myths that gets busted, that women, understanding that only 5 to 15% of breast cancers have a genetic connection to the extent that we know right now. And so for every woman, though, that is diagnosed with breast cancer, we do offer the genetic testing to see whether or not there is a genetic connection, so that, and we're principally talking about the BRCA1 and 2. And we test the suite of genes, but that's the two principal ones, and let them know that we're looking at this not just for their daughters, but for their sons also, and helping them understand that for ones that have when they're coming and we're talking about their risk of breast cancer, we're asking the family history on their mother's side and the father's side, helping them understand that they can get the gene passed through to them from their dads as well. So it's one of the things that we do, and so a number of women will want to be tested because they want to have information for their sons and daughters.
And have you ever participated in a prophylactic mastectomy?
Well, yes, we have patients. We have patients that, in the setting of, at least they have something that's abnormal.
Okay.
The finding. So most of the time when a patient gets referred to me, it's because they either have something suspicious it's usually always to rule out breast cancer. It may end up being for something that's benign, but typically it's to rule out breast cancer. So for those that do have breast cancer, and even if they don't have a familial connection, some women prefer to have a mastectomy, and then they want to have a prophylactic mastectomy on the contralateral, on the opposite side.
Mm-hmm.
So so we will do the bilateral mastectomy in that setting, typically with reconstruction at the same time. Although I have had in some older women that they don't want to have reconstruction, which is fine. They want to just have the mastectomy and they want to have it bilaterally. So and the gamut. And we have some women that they will have their mastectomy on one side and have maybe a reduction on the other side, of matching surgery on the opposite side. So many times they have their breasts looking better than they were before they actually had the breast cancer, because now their breasts are symmetrical. Most women's breasts are not symmetrical,
right?
So they're. I mean, no one wants to have cancer, obviously, but as a perk of that, then they find they have. Sometimes they get a tummy tuck and
I was about to say that. I knew somebody that's what they did.
Breast bilaterally time. So
and you're like, while you're in there.
Yes, that can happen.
Suzette, how did your family members and did you have any caregivers that were able to support you?
That's one of the great things about cancer, is you find out, like, it weeds out like who your ride or die people are. So yeah, I did have a friend that like actually moved in to help take care of me. So that was great. And then, I had other caregivers too, but I was pretty strong. I actually sailed through radiation and chemo really well. It's been like the after effects of the hormone therapy, the anastrozole and the tamoxifen. There's really like set me out for a loop. Like, it's made, sometimes I'm like near paralysis and stuff like that. But But like, yeah, I've been like, it's been a champ. I've been a champ. And then one of the things that I found that was really helpful though, more than anything, and I advise this to people to bring up your spirits or whatever, was music. I woke up every morning to a rave. If chemo wasn't gonna beat the cancer out of me, Beyonce's Formation was. You know what I mean? Like, who's run the world? Boobs. Who's run the world? Boobs, boobs. So it's like, so you just have to find a way to celebrate, and that's really is like what kept my spirits up, and I want to recommend it to everybody. My energy level up, everything.
Now, prior to the diagnosis, were you somebody that was healthy? Like, did you exercise, eat right, all that good stuff?
I was shocked. I was like, what? Me? Like, what? Yeah.
Okay.
So the thing is, I made a promise to my mom that, when I found that I had cancer, I apologized to my mom because I did everything I could to try to stay healthy. Yeah, I was, I mean, yeah, I could not. Yeah, I was shocked. Like, why? I didn't want to say why me, but I thought I was doing all the right steps, and I was also surprised to find out how far along my cancer was because I had been doing the mammograms. But and this is my point. My point is that everybody should be doing breast self-exams, because if I had been doing breast self-exams, I would have found the cancer a lot earlier. I was just relying on mammograms. And so that's my big thing, is like through Strong Black Boobs, is that I really want women, I want you to love yourselves once a month. Put on a little Luther Vandross and get busy. Your boobs will call you back in the morning. You just got to get busy, ladies. You got to know every inch of that boob and your neck and your lymph nodes. You got to treat yourself like you want your partners to treat you. You got to like serve it up to yourselves. And then also too, like if you have a partner, a lot of cancers are found by partners too. Mm-hmm. So if you have a partner, your partner can just, at least once a month you're going to get it. Like you just need to get in there, and you need to like, circle around and go up and down and just, have a good time. At least, once a month you're going to have a good time. But breast self-exams are really, 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 really important. And people stress mammograms, but, my cancer wouldn't have been as far along if I had done breast self-exams.
So Dr. Dempsey, I have a question for you. Her reaction to chemo and radiation, do you think it attributes to the fact that she was a healthy individual going into this?
For sure. When you're already, strong and healthy to begin with, you definitely tolerate, chemotherapy and radiation better, but still it's a tough go, right?
Oh, yeah.
Suzette, I mean, it's not no walk in the park, even if you're looking at the person next to you and saying, I think I'm maybe having an easier time than them, but still, it's a tough go. And I just have to commend you so much, Suzette, on your attitude and your sense of humor. It's just incredible. I mean, I wish everybody could kind of find that, within themselves as they go through this journey, because I'm sure that it's been really helpful to you. And, I just think that positive attitude, it makes such a difference in your treatment. And I really think of breast cancer kind of as it's a life trauma. It's a traumatic event that changes who you are forever. And if you can approach it with, whether it be a sense of humor or, faith or other things in your life that can kind of help to support you through that journey, I just think not only do you maybe experience that trauma in a way that you can process a little bit better, but I think it also impacts outcomes. I just think positivity makes all the difference. So have to commend you on that. Love listening to you talk.
And then I recently we have been told that self-exams were not necessary. So I wanted somebody to please talk about that.
No, it's exceptionally important. And yes, it is important. The issue, I think that a little bit of the problem has been that it's hard to prove that the breast self-examination decreases mortality rate. But what happens is breast self-examination does a couple of things. One, it causes someone to become familiar with their own breast topography, their own breast geography, put it that way. So if you're examining your breast once a month or even every other month, you are going to know if something's different. And even in women that have very lumpy or very nodular breasts, if this area that was lumpy in a way before is lumpy in a different way now. Maybe it's a little bit harder. maybe there's something else going on, and that can happen long before. You may find that after you've had a normal mammogram. So certainly, if you feel something in your breast, or if your partner feels something in your breast, then go get it checked out. Don't assume that because my mammogram is fine, as Suzette was relating to, is if my mammogram is fine, that means I'm fine. It's not true. These things are all complementary. So your breast self-examination, even if you've seen your healthcare provider that does breast exams, because they may see you once a year.
Mm-hmm.
Compare that to you're examining yourself 12 times a year. Who's going to do the better exam?
Right.
It's definitely an important part of the whole process. Our breast examination, our imaging, and then the clinical breast exam. So we definitely encourage it. We tend to say, or I tend to tell people, and they say, when should we start thinking about our breast and examining our breasts? And I would say, probably, around 18, 19. Just so that you know what your breasts are normally feel like. I've had, teenagers that come with a breast mass that they found, and it's by and large typically going to be something that's benign, but sometimes it's something that still needs to be removed.
Mm-hmm.
And so for ones that find, something like called a fibroadenoma, or sometimes it's even a phyllodes tumor, so it's a rapidly growing breast tumor. They know how long they've had it because they found it in the shower, or they've noticed the change. So the breast self-examination, I think, is extremely important.
I think a lot of us struggle with the fact that the guidelines no longer recommend that we tell patients to do self-exams, because so many of us have had patients that come to us because they found the lump themselves. And, so I think you have to be aware of your breasts. If you still are having a period, the best time to do your breast self-exam is right at the end of your period. And I think it can be really helpful to do that in the shower, because when the breasts are wet, it's kind of easier to slide your fingers over the skin and make sure that you're reaching every single part of the breast in a really systematic way. So imagine you're washing the windows, you're going up and then over and then down and then over and covering every part. Keeping in mind that a lot of times if you feel a little lump, it doesn't necessarily mean that it's cancer. There are hormonal fluctuations that women have, particularly, before they go through menopause, where sometimes you will feel a little bit more lumpy bumpy at certain parts of your cycle and then less so at others. But if there's something that's out of the normal for you, make sure, another good plug for having a primary care doctor or an OBGYN that you see on a regular basis, because then if you do find something in your breast, you already have a healthcare provider that you've got a good relationship with, who can then, carry on the rest of the investigation.
We found this to be particularly true after COVID, because during COVID, you had a lot of breast screening that wasn't being done because of the fact that we weren't doing routine screening. So you had women that it may have been 2 years since they had their mammogram, and they were coming with large masses.
Mm-hmm.
So that kind of underscored the importance of breast examination.
Yeah.
Also too, I defer, of course, to the doctors, but a lot of women of color are getting cancer younger, and it's before the mammogram guidelines. So by the time they get a mammogram, it's way advanced. So it's really, I suggest to everyone that I talk to, if you're Black with breasts, if you got boobs out there, you need to be doing breast self-exam. Anybody with boobs, if you got a pair of boobs, do it. I'm talking to you with boobs. That's right. You know who you are.
Yep.
So
Dr. Renee,
too, that when we're talking about examining the breast, we're not talking about just the breast, but we're talking about the area of the neck here and up under the arm too, because the breast is shaped like a teardrop, so it goes up under the underarm, in the underarm area too. So making sure that we do that, and also that we look in the mirror, and that we're looking to see if there are any changes to the skin, any changes to the nipple, putting our hands on our hips and pressing in to see, so it flexes the chest wall muscle, that it stiffens the muscle behind the breast, so that you can see if there's anything that pulls too. In the breast, of the breast skin, see if it's tethered in any way. Those are other things that we look for too.
Yeah, it's very important for people to please know your body. So look at yourself in the mirror naked and make sure you know, because if anything is there that wasn't there before, you need to let somebody know. Because
Mhm.
early detection is the best thing ever. I had a friend that was 31, I think it was, felt a lump, told the doctor, they said, "You're too young," blew her off. And then when they finally did diagnose her, she was stage 3.
Yeah. I mean,
So,
if you feel a mass, I don't care what the mammogram or the MRI shows, like go see the breast surgeon and have them look at it, because even if the mammogram is negative, because mammograms can be negative even when there's
mhm.
cancer, and somebody needs to put a needle in there. And then I think Dr. Jones can correct me, but after your cycle is the best time to examine your breasts.
Yes.
She might have said that already. I've been having connection problems, but
No, no, Lucy mentioned it, but you are correct. The week after your cycle is the best time, because during your cycle your breasts are more sensitive to hormones. You can have a lumpier breast. You can have cysts that enlarge, that decrease after that after your cycle is over. And also, I want to make a plug for, if you feel something and you are pregnant, don't ignore it. Pregnant women get breast cancer too.
Mhm.
yes. Yeah. So I was gonna say, I'm gonna ask Suzette this question because you brought up the Dr. Renee brought up the point about being a cancer survivor. I have not, thank God, been a cancer survivor. I've had breast cancer scare. I've had a clip put in my breast, just like Dr. Renee. But I have been on this journey many times with my cancer patients the last 14 years. And one of the things that profoundly changes is their tolerance for BS, right? So after they've gone through breast cancer, they just don't have time for drama as much. Like they try to hone in on what's important to them. They try not to let themselves get dragged down. Some people it's easier said than done. There's always work drama. Sometimes the work drama doesn't get to them as much after they've had to fight for their life. I think it's very different to live with metastatic cancer than to live as a cancer person who's gone through early stage breast cancer treatment, but always it impacts mental health deeply. And the worst time is when the treatments are finished. People are so much more anxious because they're just waiting to make sure that they're not having recurrence, and trying to reconnect with their new body. Hormonal changes, like hormonal blocking, can change your I mean, talk to my friends who have physicians who are going through menopause, the anxiety, the hot flashes, the mood swings, and then we induce that in patients, sometimes some very young patients, and then they have more mental health issues, more problems like trying to find themselves. So I think it's very hard to be, especially a breast cancer survivor, because we treat breast cancer longer and harder than a lot of different cancers. We have the best survival in breast cancer, but we definitely overtreat a lot of women, and there's a lot of toxicity associated with the treatment, the scar tissue, even like, no offense to the plastic surgeons. There's very few reconstructions that look amazing, and there's not always a time and a place that it doesn't cause some anxiety when you get a deep flap and then the fat breaks down in your breast and it's actually fat necrosis and they think it's cancer recurrence, or the implant has flipped or leaked and somebody has to get that removed, or the expander's gotten infected. There's always some, it doesn't happen all the time, but there's some of that which complicates things even more, because everybody's hoping to have a smooth journey. They're not going to get neuropathy from their Taxol. They're not going to get a bad infection. They're not going to have their reconstruction retweaked over and over again. And it can be discouraging. So I think I'm just going to put a plug out there that, when you've seen your patients suffer through a lot to try to recapture their health, you're hoping that when they come out on the other side, that they're going to have this amazing life, that they're going to appreciate everything around. And I think they do, that they appreciate things on a lot deeper level, because it changes them just like it changes us who treat cancer. We look at things differently too. We don't let things bother us as much because we know there could be worse out there. So it gives us perspective. But it's just, it's really hard to sort of, find, let life stresses like completely melt away. But I think that, people do look at life differently, do look at themselves differently. And you hate to see your patients go through hardship after they've gone through fighting for their life. Sometimes that is inevitable, but I think it's very important to work on physical health, mental health, get to a therapist, get to a psychiatrist if you need to. Don't be ashamed of taking anxiety medication or depression medication if you're having mood swings, because to live your life in a good place and where you see more good than bad, where you have more happiness and unhappiness, is the way you sort of win. Because I think Suzette made a point like, I'm just gonna fight breast cancer and like just to go pay my bills. I mean, yes, but hopefully to like recapture your health so you can go on a trip, so you can go enjoy some weddings, so you can go, you know, achieve your goals, run marathons again. If you need physical therapy to break up that scar tissue so you can straighten yourself out to go do the things you want to do it, you know? So I think those things are important to remind people that even if you're living with metastatic cancer, for us, it brings us joy to see that our patients are having quality of life and they're still getting enjoyment out of life. They're able to push things in the background, push the cancer in the background, push themselves in the forefront, because it's always very stressful and very sad when you have a patient who lives in fear, lives in anxiety, and is not able to enjoy every moment, and like, or at least enjoy more moments than being stressed out.
I totally agree. I say look for the happier sides of the journey. So I say I may have cancer, but at least I'm not on jury duty. You gotta look at the wins in life.
This is true. Were you a comedian before this?
I wanted to be. I was an aspiring comedian, but I was more like a producer. I started an organization called NY Laughs, and we produce shows in parks throughout the city. But because of the disparity, and that I felt like what the awareness campaigns that were out there. First of all, I thought like comedy is kind of my superpower. So I was like, well, why not try to put that to good use in this way? But also, I just also felt like maybe there needs to be a different tone in trying to just get the message out. It hasn't helped. Like I've been banging on doors and like, you know, trying to get out there to just to get people to look at the disparity in a different way. Like, you know, like we can fight this, we can do this. Like it doesn't have to be 40%. We can laugh through this. So it actually like is like sparked my material and my creativity comedically, but I still feel very much like an outlier. Like a lot of the other comedy world doesn't know how to take like jokes about, you know, breast cancer. But I'm like, it just all boils down to boobs in the end, right? It's just boobs.
Right.
October is a time when I just say like bad boob jokes for charity. It's about boobs in the end. If we can just talk about boobs, and maybe that'll help us get to the point where we can knock down the 40. Black women will know, like, you need to be on guard. You need to be vigilant. You need to talk about this.
Do you know my friend Michelle, the indie mom of comedy?
No, I haven't heard of it.
Okay, she's in New York too.
Okay.
Okay, yeah. But yeah, I think that your outlook on it is wonderful, and I think that Dr. Kotaya is correct. And I've always said it's called dis-ease for a reason. Dis-ease. So that's why you really do have to, I mean, as awful as it is, you have to figure out how to get a positive attitude so that you can turn things around and, you know, and have a better outcome, God willing. So I think that, you know, I love that you're a spirit, and I think that you're right. And every day people should be able to laugh about boobs, because this is something that, as you mentioned, is getting younger and younger Black women, unfortunately. And like you said, the mammograms, they have not changed the age. You know, colon cancer was getting people younger and younger, and they changed the age for colonoscopies, but they have not changed the age for mammograms just yet. And then I know I had a friend that was having trouble. She had a mammogram, but her doctor wanted her to have an MRI, I believe it was, and her insurance company refused. And she had to fight them tooth and nail. She did finally end up getting it. But, you know, how long did that, you know, prolong her diagnosis? You know, so it's just really, you know, and then also I think that's the other thing with the patient navigators. I know as a caregiver myself, I was on the phone today for an hour with an insurance company. Not everyone has time to do that. And the patient that I'm caring for, my lovely father, he can't do that. He can't do that for himself. So that's why I thank God I was able to do that. But I think the patient navigators, that is amazing, because I bet you they do have all of that great information, the insurance companies and all of the ins and outs of all that stuff. It can be very helpful. And I just wonder, are those patient navigators available at these public hospitals that, like Suzette mentioned?
Well, I did my training at least at a public hospital in Miami at Jackson Memorial, and we certainly didn't have things like patient navigators. We didn't really have much support at all. I was my own nurse practitioner and scribe and secretary, and you know, you do everything kind of on your own. So not having that support, it means that your time as a physician is kind of spent more doing non-physician things rather than kind of taking care of patients. And so having that complete team of support staff, it makes such a difference. I think, even if you're in a private hospital, in a insured situation, navigating the American healthcare system is really difficult.
It truly is.
Even for physicians ourselves, it's hard to navigate this system, and we understand it, let alone kind of by definition, most patients that get a definition of a diagnosis of breast cancer, they don't know how to navigate any of the system. They're kind of just being thrown in trial by fire and trying to figure it out while they're also dealing with all of the stress and the physical, discomfort, and then on top of it trying to fight with an insurance company while you're feeling nauseous from chemo. It's so unfair that gets put on our patients. And so I think that's where having that family support, Dr. Renee, like what you're doing for your father, that there's just got to be that person designated in your family. This is the person who's going to come to my appointments and take notes about everything that was said, because maybe I've got chemo fog and I'm not really hearing everything that's being said. I can look at the notes later. Maybe that same person or somebody else can help me schedule all my appointments when the hospital's calling to schedule all these different things. Have a designated person who's got access to your calendar and can help you schedule, so that the things that you don't have to do yourself, someone else can help you with.
Yeah, it's so important. So important.
I was going to say,
go ahead.
We are in a community-based hospital in Baltimore. When I started 14 years ago, we had one nurse for like 4 physicians. And the hospital has evolved over time to understand that having supportive care is very important for everybody. So at this moment, I have 2 nurse practitioners who work under me full time, and they field a ton of phone calls, labs, emails, because the patients email us a lot now. So probably sometimes like 100 messages a day. And we have 3 nurse navigators to help with getting drugs approved for by insurance companies. My nurse practitioners help with peer-to-peers for like imaging that gets denied. One of the nurse navigators helps with FMLA paperwork and, disability paperwork. I have 2 social workers who help with. It's so important to have that team, because then you as the physician can focus on, this is your treatment plan. This is, I'm going to pull you through the treatment plan. These are the side effects I want you to be aware of. But, having navigators is crucial. And we even have a separate patient navigator to help with transportation and to help with resources and connecting people with resources in the community. So I think navigators are making a huge difference for the patients and for us. And the breast center has a nurse navigator to help them through post-op stuff, pre-op stuff, getting them to physical therapy to get their measurements for their lymphedema and all that stuff. And then our nurse navigators make sure the patients get plugged into the chemo infusion appointments, get plugged in to get their scans if we order them, get plugged in to see the radiation oncologist. They help us move with all these moving parts so that patients don't have to, if they get lost, they call the navigator and say, what am I supposed to be doing next? Or I'm having trouble getting my letrozole. They need a prior auth or something. Like they need a prior auth for the pain medication that the doctor ordered for me. They take all that off my plate. I cannot function without them. They really keep my work-life balance intact, and they really help the patients with these headaches that you're dealing with your father. It's really, I think it's very important to have navigators.
Very important.
It is exceptionally important. The navigator will come actually to my office to see our post-op patients. I will have introduced them when I talk to them and give them the diagnosis, and we talk about what the plan is and what the team is. The team always includes the nurse navigator. So I'm telling them about the nurse navigator, but I'm not necessarily meeting them at that section, at that session. But when they come for the post-op visit, the nurse navigator typically is at that session too, and then they can have a conversation also about and they will have already talked to them on the phone, because for those that need to see an oncologist, they help to arrange all of that. But it is really, really, they are a really, really important part of the team. And as you were saying, Dr. Cataia, the other things, getting them with the testing, and also with other things like yoga classes, like other programs, Look Good, Feel Better. So many different other things that are of our benefit to our breast cancer patients. Also, for the support groups, one thing that Suzette was mentioning is that there are different types of support groups, because not all support groups are created equal for people at the same stage. So early stage breast cancer patients don't necessarily belong in the same support group as patients that are living with metastatic disease. So, or patients that are in a pre-op situation. So it is important to get people in the right kind of setting. One thing that we haven't sort of talked about, and perhaps Dr. Katai or Dr. Dempsey could talk about, is cold cap.
Oh yeah.
Saving your hair. Drinking with hair.
Yeah, so cold capping is a really valuable tool that we have that can help to prevent hair loss during chemotherapy. Basically, the way that it works is you get a hat that's really kind of tightly affixed onto your scalp, and it's cooled because you don't need chemotherapy delivered to your scalp. And by cooling the scalp, the chemo doesn't get delivered there, and you can save your hair. Now, it kind of depends on which chemo regimen you're getting. The cold capping is more effective with certain chemo regimens than others. There are a few downsides. I mean, it does add on to your infusion time. There is usually an out-of-pocket cost associated. But if you've got the chance to save your hair, it may not look the same as your hair looked before chemo. You're not supposed to brush it real aggressively. You're not supposed to wear it back really tight. You'd wash it once a week if you're cold capping. So it may not look kind of as fabulous as it did pre-chemo, but helps it to grow back in stronger later and faster. And a lot of these chemo regimens, up to 70% of women at the end of chemo that cold cap say that they feel like they can go out without a hat or a wig and nobody else can tell the difference. They can tell the difference, but that other people probably can't. And I just think, when we think about self-image, I mean, as women, our hair is important.
Mhm.
When you look in the mirror, you want to feel like you look like yourself. And so when
When you look good, you feel good. That's
Of
what my
course.
mom said. So
And when you're dealing with all the rest of the impacts of cancer, then on top of it, having feeling like you look in the mirror, you're not yourself. Maybe with the steroids that gave Suzette all the energy, they can also give a little bit of the chipmunk cheek kind of look, and then people have lost their hair, and that's really hard on body image. But I always tell people all of this is temporary. Your hair is going to grow back. Your face is going to go back to the way that it was. You're in it right now, but there's going to come a time where this is behind you and you're going to go back to your normal life.
yeah.
And I do tell people that it might not work, like Dr. Dempsey says. The Taxotere chemo that we give is really hard on the hair. 7% of people will have permanent hair loss and it will never grow back again. And there were lawsuits about that in the past. And some people will grow back, but more like thinner, stringier, and some people will grow back fine. So, it's always worth trying, but it will cost money. It costs a few $100s, per month, I think. And not everybody can afford that. If you're getting a regimen like AC, which is Adriamycin cytoxin, followed by Taxol, the Red Devil drug, followed by Taxol, your hair's gonna grow back. So if you don't have the money for the cold caps, it's probably not a big deal. But, if you don't do the cold capping, after the first cycle of chemo, within 2 to 3 weeks, your hair will completely fall out. So, and that's a shock for people. It's not like it sheds slowly, gives you time to adjust. No, it like completely goes. And it's like on your pillow, so you have to cut your hair and then prepare for that so you don't inhale your hair. It is very traumatic, but I've had patients who tried it even on the Taxotere, and as long as they were doing what Dr. Dempsey said, where they're very gentle with the brushing, they're not washing it all the time, they've actually managed to retain their hair, which they never would have been able to do if they didn't do the cold capping. So it's worth looking into. And sometimes there's some grants that you can apply for to get it somewhat discounted. But these are things that we can try to do. It's because that was, I think, almost the most. It used to be nausea and vomiting. We've gotten much better, and now it's like, can I not try to loosen my hair? So we're working on that too.
So I'm talking about the advances though in taking care of breast cancer, or even in diagnosing and treating breast cancer. Most breast cancer surgery is outpatient. That's one of the things people don't recognize. Most people aren't staying in the hospital at all for the surgery. So your diagnosis and your treatment may be completely outpatient, which is a really great thing. Or at most, it may be an overnight stay if we're doing reconstruction. So so that there are several advances.
And that brings us to a great point. We're almost at the end, but clinical trials are so important, and that's why we've gotten all these advances, because we've had people participate in clinical trials. So if you have the opportunity, please participate in a clinical trial. They have clinical trials. There's a spot on the blackdoctor.org website where you can see if you qualify for any of the clinical trials, but there are several that specifically have to do with breast cancer. And I have a friend, touched breast cancer, Ricky Fairley, who has really been instrumental in finding Black women to participate in these clinical trials so that they can find, the best chemos that'll work for us, and all of that great stuff. So please, please, please participate in clinical trials, and don't think you have to be sick to participate in a clinical trial, because you do not have to be. You can
Yeah,
do
I did.
everything
I did.
well.
Yeah, I did 2 clinical trials. One was aerobics, on the effect of aerobics on post-cancer treatment. So I got a free treadmill, and then I got like an hour. I had a clinician on the other side. So basically, it was a free treadmill and a personal therapy session for an hour. Woohoo!
That's awesome. And I bet you they paid you too, didn't they?
Not really. They didn't pay for that.
Okay.
They
But
gave me
they gave you a
like a
treadmill,
Fitbit
so,
or something
okay.
like that. But yeah, I just wanted to leave my DNA.
Yeah.
Black
But
women.
everyone, if you could, we'll start with Suzette, but I want to make sure everyone lets our audience know how they can find you in case they have other questions. So Suzette, go ahead.
Yeah, you can find me on Instagram, on social media under Strong Black Boobs. The hashtag, the strongblackboobs.com is my website. So yeah, so please follow me. I do all sorts of things, PSAs and stuff like that. So yeah, just please, I'm trying to save Black boobs, and I have opportunity to be on blackdoctor.org.
Thank you so much. Dr. Jones?
So I'm at Cynthia.Jones2 at atlantichealth.org.
Thank you. Dr. Dempsey?
My Twitter handle is at Naomi Dempsey, or my email is naomi.dempsey@baptisthealth.net, and would always be happy to speak with anybody that was struggling or having questions or needed anything.
Thank you. And Dr. Kotaya?
I don't have a Twitter handle or TikTok or whatever. I do have an email. It's skataya@mdmercy.com. But I want to make a point that I think needs to be made. I don't know how Dr. Dempsey feels. There's not one of us who are medical oncologists who wouldn't love to give you some like sprinkle of like magic dust, or like some apricot seed or some vitamin E to try to get you past your cancer. We would be the most popular oncologists in the world. Everybody would line up. We would be buying continents with how much money we made, right? So it's not that, I poo-poo on holistic medicine, but we try to be as evidence-based as possible. And if you want to do something integrative, like an acupuncture kind of thing, or like, do something to try to do in conjunction with what we have, great. But the reason we need clinical trials is we know that the response rates are not 100% to whatever we do. We would like for everybody to have a 100% cure rate. That doesn't always happen. Some people have tougher cancers than others. Some people respond to treatment, some people don't. So we always try to lay it out for you. If you have a triple negative breast cancer, chemo is probably going to be 70-80% effective. If you have an estrogen-driven breast cancer, it might be 30% effective, right? So maybe hormonal blocking will be better for you. But either way, if we can improve even on the standard of care, there's a good phase 3 trial. They offer it to you. You might respond better. You might not. You won't find out for years. You're doing it for the benefit of your community, and it might benefit you, but you don't know that at the time. And, you have to build trust. You have to sort of understand why you're doing it. But, it's important for us because the way, like you said, Dr. Renee, like the way we come up with the treatments today is because of clinical trials that were done, looking at treatment A versus treatment B to see what works the best and what's the least toxic thing. So we continue to try to evolve, like who can we admit treatment on? Who do we need to give more treatment in? Whose breast cancer is going to behave better, who's not? So we're trying to figure things out at the molecular level, come up with more tailored treatment, come up with smarter treatments. But the people who do the worst are the ones we always feel helpless because we felt like we could have done something else, but we don't know what. So research is very important for that.
Yeah, and the research has come so far. So please, if you can, participate in a clinical trial and make sure that you find a team that you trust. And maybe you need to get in touch with one of these ladies to find out if they know somebody in your area that you should go to because you liked what they said or something. I don't know, but we always say here at Black Doctor, do not wait to fire your doctor. You can fire your doctor. You have
Well,
to
your
make
best
certain that
advocate.
they're listening to you and you're listening to them. And if for whatever reason, the way that they're speaking, you're not understanding and they're not understanding your questions, then you should find someone else, because all of the diseases, not just cancer, are very important. You need to understand exactly what's going on and what you need to do. And when it comes to cancer treatments, you really need to understand exactly what you need to do, where you need to be, why you need to be there, what you have to do to be prepared for the treatment. So you really need to make certain that you and your doctor are on the same team and everybody is, trying to get to the same goal. Thank you, ladies, so much for your for all this great information this evening. And Suzette, you keep cracking us up, and let us know where we can find you.
It's not just me; it's my boobs. I want to
go see you. Exactly. But yes, everyone, please go follow Strong Black Boobs. But thank you so much, doctors. You guys were fabulous, and everyone have a great evening.
Thank you.
Thanks for
Thank
having us.
you.
Love your glasses, by the way.
Thank you.